The topic of today's session is social franchising and health. Specifically, we will be looking at the emerging challenge of non-communicable diseases in the developing world and the role that the private sector in general and social franchises in particular may be able to play in addressing them.
And there's three things that I'm hoping to come across in the next 15 to 20 minutes. And one is that non-communicable diseases are a major health challenge for low and middle income countries now. It's projected to get worse into the future. There are effective and cost-effective approaches to address, to both prevent and treat many non-communicable diseases in developing country and low-resource settings. And we need to start thinking about opportunities and strategies for integrating that into the existing platforms that we have within the global health community to address the current diseases, which are a major focus.
Many countries of the developing world, people who are going to seek care, regardless of whether it's a communicable or non-communicable disease, are likely to go to a private provider. And there's going to be a full range of private providers that they'll have a choice from a high-end private hospital in a capital city to a small clinic in a secondary city to an informal provider in a rural village that may not have any training or much training at all. So a lot of people are seeking care in the private sector. As Catherine mentioned, there are 33 countries, as reported most recently by the WHO, who now have out-of-pocket spending greater than 50% of total health expenditures, and almost all of these countries are low, middle-income countries. They also, I might add, many of the countries on this list are the largest countries in the world, such as India, Pakistan, Nigeria, Cambodia, et cetera. So there's a lot of people living in highly marketized systems, so it's very likely that someone with a non-communicable disease, their first point of contact is going to be a private provider. And as we've mentioned, social franchising is a model that has the potential and has been shown to improve quality of private providers by standardizing care. And so I think it's definitely a model that we need to be thinking about as a possibility for NCDs.
A social franchise network is a service delivery mechanism, working with the private sector to improve health service delivery through the private sector using commercial techniques. So in PSI, our social franchise networks work to the 4 goals of social franchising as defined by the global health community, chaperoned by the Global Health Group in UCSF. So the goals that we have outlined for social franchising are to increase access, quality, cost effectiveness, and equity of the service delivery channels when serving those in need. So when we think about social franchising and its application to the NCD agenda in a very general terms, there are probably 2 main ways that we can think that there is applicability. One is the operating system. A franchise network basically provides a franchisee with an operating system, which effectively are the quality standards that the franchisee works to. When we talk about NCDs, we talk about standardization of services through private providers, and there's a natural alignment there on that agenda. Similarly, a franchise is comprised of a support system. A franchisor provides support to the franchisees. This, again, is along the lines of training, capacity building, subsidized supplies, and commodities. Again, within the NCD agenda, there is a need to probably support the private sector with these elements, and the franchise mechanism is a way to do that.